Which specific embryological structure fails to develop properly in a persistent VSD? A. Foramen ovale. B. Septum primum. C. Interventricular septum. D. Ductus venosus. Answer: C. Interventricular septum. A Gerbaud defect refers to an abnormal communication between which two chambers? A. Left ventricle and right atrium. B. Left ventricle and pulmonary artery. C. Right ventricle and aorta. D. Left atrium and right atrium. Answer: A. Left ventricle and right atrium. In the setting of a large VSD, what is the significance of a mid-diastolic rumble at the apex? A. It indicates mitral stenosis. B. It suggests aortic regurgitation. C. It indicates a high volume of flow across the mitral valve, QP/QS2:1. D. It is a sign of tricuspid valve prolapse. Answer: C. It indicates a high volume of flow across the mitral valve, QP/QS2:1. Which chromosomal abnormality is most frequently associated with atrioventricular canal defects, including VSDs? A. Turner syndrome, 45X. B. Down syndrome, trisomy 21. C. Klinefelter syndrome, 47XXY. D. Marfan syndrome. Answer: B. Down syndrome, trisomy 21. During cardiac catheterization, what finding confirms a left-to-right shunt at the ventricular level? A. Oxygen desaturation in the left ventricle. B. An oxygen step-up in the right ventricle compared to the right atrium. C. An oxygen step-up in the pulmonary artery compared to the right ventricle. D. Decreased pressure in the pulmonary artery. Answer: B. An oxygen step-up in the right ventricle compared to the right atrium. What is the classic surgical approach for repairing a paramembranous VSD? A. Left thoracotomy. B. Median sternotomy with cardiopulmonary bypass. C. Percutaneous closure only. D. Video-assisted thoracoscopic surgery, VATS. Answer: B. Median sternotomy with cardiopulmonary bypass. Doubly committed VSDs are most prevalent in which ethnic population? A. Caucasian. B. African American. C. Asian. D. Hispanic. Answer: C. Asian. Which of the following is a potential complication during VSD repair surgery due to the proximity of the defect to the conduction system? A. Atrial fibrillation. B. Supraventricular tachycardia. C. Complete heart block. D. Ventricular fibrillation. Answer: C. Complete heart block. In a patient with Eisenmenger syndrome, why is supplemental oxygen often of limited benefit? A. Oxygen causes pulmonary vasodilation. B. Fixed pulmonary vascular resistance prevents increased flow regardless of oxygenation. C. The hemoglobin is already 100% saturated. D. Oxygen is toxic to the right ventricle. Answer: B. Fixed pulmonary vascular resistance prevents increased flow regardless of oxygenation. A 3-month-old with a large VSD has failure to thrive. Which mechanism primarily contributes to this? A. Increased metabolic demand and poor feeding due to dyspnea. B. Primary malabsorption in the gut. C. Growth hormone deficiency. D. Chronic renal failure. Answer: A. Increased metabolic demand and poor feeding due to dyspnea. Which heart sound is typically widely split and fixed in a large VSD? A. S1. B. S3. C. S4. D. None. Fixed splitting is characteristic of ASD, not VSD. Answer: D. None. Fixed splitting is characteristic of ASD, not VSD. What does the term restrictive imply regarding a VSD? A. The defect is restricted to the muscular septum. B. The patient's exercise is restricted. C. The defect is small enough to maintain a pressure gradient between ventricles. D. The lungs are restricted from expanding. Answer: C. The defect is small enough to maintain a pressure gradient between ventricles. Which imaging modality is considered the gold standard for the initial non-invasive diagnosis of VSD? A. Chest X-ray. B. CT angiography. C. Transthoracic echocardiogram, TTE, with color Doppler D, cardiac MRI. Answer: C. Transthoracic echocardiogram, TTE, with color Doppler. A muscular VSD located at the apex of the heart is often referred to as what? A. Swiss cheese VSD, if multiple. B. Malalignment VSD. C. Inlet VSD. D. Membranous VSD. Answer: A. Swiss cheese VSD, if multiple. Which medication is strictly contraindicated in a patient who has developed Eisenmenger syndrome? A. Sildenafil. B. Bosentan. C. Pregnancy, due to extremely high maternal mortality. D. Warfarin. Answer: C. Pregnancy, due to extremely high maternal mortality.